No more cash for the NHS, says Health Secretary Sajid Javid. It's worth reminding you it does get £3 billion a week. No more cash for the NHS because it's not fair on the young. Now, despite chaos in A&E departments, and we touched on this earlier this week, didn't we, with one of the callers saying how he spends much of his shift just waiting at A&E, being a paramedic, he has someone on a trolley, and he has to stay with them, because he can't effectively hand them over or discharge them to the care of the A&E team because they've got no one available. So his shift was just spent sitting with or standing with that one patient. So chaos in the A&E departments, allowing spending to balloon, would be at the expense of other services, such as education or housing, says Sajid Javid. Meanwhile, NHS Chief Executive Amanda Pritchard says the current issues in the health service, including unacceptable 12-hour wait for emergency care, mean the next 2 years could be worse than the pandemic. Shall we let that just hang in the air for a moment? The next 2 years could be worse than the pandemic, says the boss of the NHS. And we know how many people, and we're still catching up with how many people missed treatment, and in some instances sadly died because they didn't get treatment for cancer, health conditions, whatever else it might be. She says you can trace the line from delayed discharges to A&E crowding all the way through the slower ambulance response times. It's difficult to see social care capacity being significantly expanded ahead of winter. The last 900 days have been tough. I think the next 900 could be tougher still. Goodness me. Now, health spending accounts for 27% of day-to-day public spending in 2000, is set to rise to 44% by the year after next. So essentially, all the taxes you pay, everything that's levied, whether it's through income tax, NI, VAT, whatever else you want to do, roughly 50p in the pound will go to the health service. And let's be candid, it's not working, not through the fault of most of the practitioners. Something else is clearly going wrong. It had a £12 billion a year funding boost recently, paid for through a rise in NI, in national insurance. And now, when questioned whether more cash should be made available, Sajid Javid says no, it's not fair, because obviously young people require services such as education and housing. So here's the thing. If you're getting towards spending 50p in the pound on health, so other matters such as housing, education, the environment, defence, work and pensions, everything else has to get to the back of the line. How fair is that? Robert Eade is head of Policy Exchange's Health and Social Care Unit and is with me now. What level of support do you have for the Health Secretary's stance here? Good morning.
Hi, good morning, Nick. I think we are supportive. The statistics that you outlined, you're absolutely right that it will make up 44% of day-to-day spending. Obviously, that does exclude things like welfare payments and pensions, which are a big cost to the exchequer. But we think that something quite radical needs to be done around the NHS. And Sajid, I think, has been quite consistent.
What should its level of expenditure be?
Well, I mean, we do contribute sort of about average compared to OECD comparator countries. So if we want a better healthcare system, if we want to be like Germany, we will have to put more money in. So that's the equation.
Let's speak with someone who's in the NHS. Dr. Bob Gill is in the southeast London as a GP, producer of the crowd-funded documentary The Great NHS Heist. OK, in a couple of snappy sentences, if you would. Dr. Gill, what is The Great NHS Heist about? Good morning.
The film is about how consecutive governments have incrementally repurposed the NHS away from a public service into a publicly funded cash cow for more and more private corporations who are driving up the cost of healthcare and delivering less output for the patients.
Right, okay. And you think then that the money within the NHS presumably is not going to the right area?
Absolutely. So in the mid-2000s, there was an estimate by the University of York in terms of the cost of administering and managing the NHS, which had by that point been turned into an internal market. The cost had risen from Margaret Thatcher's time, 3% of the budget was spent in administration, up to approximately 20%. The American system, which we are replicating, wastes $1 in $3 on management. That's 36%. And the direction of travel Javid is taking is a continuation. The health ministers do not come up with new policies. They are following a policy stream set out by the right-wing think tanks, the insurance industry from America, and the large private multinational corporations that are taking over the functions of the NHS.
So your argument is when the Health Secretary, when the Prime Minister says that the NHS will always be free at the point of care, this is simply not true. Is that what you're saying?
What they don't tell you is the range of services available on the NHS will continue to shrink. So we've already seen NHS dentistry cut down to the bone, NHS eye services practically non-existent. NHS audiology is now being largely privatised. What will happen in due course is the menu of services available on the NHS will shrink. We might lose cataract surgery, joint replacement surgery, fertility treatments. Slowly, that range of treatment available shrinks, and more money will be spent out of pocket.
But I just helped a friend who doesn't have a lot of income get an NHS dentist, and we did it in a day. There's plenty.
Congratulations. What do you want me to say? If you look at the statistics...
and funnily enough, it's in South East London. I put it to you that NHS dentistry is still available. It might not be as easy as one would choose, but they are still out there.
Sure, they're out there, but if you are seriously ill, requiring urgent A&E attention, admission and surgery, we have lost over 100 A&E departments. That means the journey time has increased. That means the likelihood of people dying before they get there goes up. We know that work done by the Royal College of Emergency Medicine showed over 5,000 people died in a year due to inability to get an ambulance and queuing up at A&E departments in the backs of ambulances and not getting a medical attention in time. Why has this happened? We've had government shrinking NHS capacity, diverting money away from the delivery of care.
They've moved to these sort of super hubs where a hospital, they would argue, a hospital has got far more kit, and an ambulance now can actually prolong, whereas when I was a kid, they just simply ferried you to a hospital. Now they've got so much kit on board that they can also sustain life while they get you to a super hub, is what they would say.
Sure, and that's a very compelling, plausible narrative. But the reality is, if you look at the hard endpoints of a healthcare system, life expectancy down, maternal mortality up, infant mortality up, delays in admission up, languishing in your own home before you even get attended to up, through the roof.
Okay.